Dear Mr. President, should all Americans be entitled to health care?
Well, the system's broken, and I think that people all across the country recognize that. Certainly I don't accept the idea that in the richest country on earth we should have 47 million people without health insurance and millions more people who are being bankrupt because of a medical bill.
Who do you think should be entitled to health care? Middle class and lower class people, and people who can't afford health care.
The key to making this happen is going to be to overcome the resistance that we're going to see from drug companies, insurance companies, HMOs. Over the last 10 years alone, the drug and insurance companies spent $1 billion in preventing health care reform from happening. That's going to require then a mobilization of energy among the American people to insist on a Congress and a White House that are actually going to deliver this time. And it also means somebody who's going to have the capacity to bring people together across various divides, getting business, getting labor, getting doctors and nurses, consumers to join together to craft this kind of new legislation. I think it's going to be difficult, but I think it's going to be possible, and the time is right because nobody is satisfied with the system as it's currently working. My plan begins by covering every American. If you already have health insurance, the only thing that will change for you under this plan is the amount of money you will spend on premiums. That will be less than what you're spending now. But if you're one of the 45 million Americans who don't have health insurance, you will have health insurance that's available to you. No one will be turned away because of a pre-existing condition or illness. Everyone will be able to buy into a new health insurance plan that's similar to the one that every federal employee, from a postal worker in Iowa to a congressman in Washington, currently has for themselves. It will cover all essential medical services, including preventative, maternity, disease management, and mental health care. And it will also include high standards for quality and efficiency. If you can't afford this insurance, you'll receive a subsidy to pay for it. If you change jobs, your insurance will go with you. If you need to see a doctor, you will not have to wait in long lines for one. If you want more choices, you will also have the option of purchasing a number of affordable private plans that have similar benefits and standards for quality and efficiency.
Do you think that the citizens of America should be entitled to health care?
No, I do not, because I think that's a lot of government spending that they're using on health care, which I think that money could be going to something like education. That's just my opinion.
Well, a lot's changed. What hasn't changed is the ever-escalating cost of health care. And so people have seen since '93, when we failed to reform health care, that costs have continued to skyrocket. I think probably the biggest change politically is that businesses now recognize that if we don't get a handle on this stuff, that they are going to continue to be operating at a competitive disadvantage with other countries. And so they anxiously seek serious reform. The fact that we've got hospitals and doctors who also recognize that the system's unsustainable on its current path. Fiscal conservatives who recognize that the single biggest component of driving down our deficits and long-term debt is getting control of Medicare and Medicaid costs, and that healthcare reform is critical to bend the curve. All those things, I think, have converged. And you are absolutely right. The meeting we had here with insurance companies, drug companies, doctors, hospitals, labor, all the stakeholders involved, nurses, we haven't seen that before. Now, it's still going to be very difficult to get a bill passed, but I'm absolutely committed to keeping this process moving, keeping a conversation going, focusing on how do we reduce costs, how do we increase efficiency, how do we make sure that families have some confidence that they can get health care when they need it and that they won't go bankrupt because their child gets sick. I really think that the stars may be aligned here, and we potentially can get it done if everybody comes at it with a spirit not of ideological rigidity, but if they come at it with a sense that, in a practical, hard-headed way, we can really negotiate and compromise and get something done for the American people.
But do you think that the cost of healthcare should be lowered?
Yeah, definitely. I think that healthcare should be lowered so more people could be able to afford it, and the money they spend on healthcare could be used for more education, things like that. So yeah, I think that would be a good idea to lower the cost of healthcare.
Okay, thank you.
If we had healthcare reform, what our patients are going to see is an increase in their quality, affordability, and access of care.
It will actually give patients more choices. They can absolutely keep their doctor and their health care plan if that's working for them. But if they don't have one, or if they want to switch to another, it'll give them another option.
It will provide them with information to be able to make informed choices that are in the best interests of their children and of their families.
It kind of brings the insurance industry back into alignment with what patients, the public wants and what we as doctors want.
What I see healthcare reform helping with is moving more into preventative care, allowing us to take care of people before they get sick, allowing our patients to be able to access care without worrying where their next meal is going to come from, allowing them to be able to pick some drugs that probably are going to work and not have to worry about how they're going to pay for them when they get to the pharmacy.
Pushing preventive health care, pushing health promotion rather than waiting until someone gets sick and then putting resources into trying to get them to feel better. I don't see anywhere that we're talking about limiting or rationing care. If anything, we're trying to open it up so that people get the preventive health care they're not getting now.
We will start to see the health of the nation improve. We'll start to see the health of individuals and families improve in a very positive way.
Healthcare reform will be life-changing for me and for my patients.